Good afternoon, everyone, and welcome again to the Multicultural Media Online Conference here, hosted by the New South Wales Multicultural Health Communication Service, Ministry of Health and Multicultural New South Wales, where you will receive updates from the Minister for Multiculturalism, Natalie Ward, and the Deputy Chief Health Officer, Dr. Marianne Gale. We welcome you. Of course, I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we're glad you've joined us here again today. We'd like to acknowledge the traditional owners of the land where we're meeting today, which are the Eora Nation. So we thank you as well for those for multicultural communities. We also acknowledge the multicultural elders represented today. Please keep, again, your microphones on mute if you can. And if you have any questions, please throw them online and on the chat, and we'll answer them as soon as possible. Again, just to remind you that we've got our masks on and off throughout the forum, just to make sure that we're able to deliver our messages clearly. Dr. Gale, how are you today?
I'm very well, thank you, Jess, and good afternoon, everybody. Nice to see you all again. So in terms of updates from me, obviously a big day today, and we're very excited to have hit the 80% first dose vaccination milestone. Look, I think it's really a great cause for celebration for all of us, and a big thank you to the community for coming out for vaccination, and for enabling us as a state to reach that target so quickly. We've really seen vaccination rates increase so fast in the last few weeks, and that's really because of every single one of our community listening to the messages around vaccination, talking to their families and friends about it, talking to their health practitioners about it, and coming forward to get vaccinated. So a very exciting day today to have reached now 80% first dose. Overnight, well, sorry, not overnight, till 8 p.m. last night, there were 1,259 cases of COVID-19 locally acquired in New South Wales. And sadly, we reported the deaths of 12 people from COVID-19. There's only a few weeks left before we reach our vaccination targets, and has been outlined some relaxation in the roadmap for New South Wales when we do reach that 70% double dose, where there will be greater freedoms for people who are fully vaccinated. So again, a big reminder for everybody, if you haven't booked in for your vaccination, or if you know family members or your circle of friends who haven't yet got vaccinated, please encourage them to do so. We are seeing a level of stabilisation in daily case numbers in a number of the LGAs of concern, and we're particularly heartened to see a decline in the Cumberland LGA and some plateauing in other LGAs, and that's really a testament to everybody's wonderful efforts to follow the public health advice, to get tested promptly and to come forward for vaccination. So we are seeing some positive signs. However, it really requires everybody's ongoing focus and ongoing attention. We don't have the luxury of becoming complacent. We have seen in other areas increases in COVID-19 cases, which shows us how easily this virus does transmit, how it does travel irrespective of geographical borders, irrespective of any particular population group. And so that's why it's really important for all of us, no matter what our circles, no matter where we live, to carefully follow that public health advice. We are concerned about some of our regional areas where we have seen sewage detections in places that we are not aware of cases. And we have asked people in those regions to please watch out for symptoms and please come forward for testing, and have a look on the New South Wales government website for new exposure locations that are going to be put up there in the period ahead. And finally, just a reminder to pregnant women out there in the community, and our encouragement to book in for vaccination if you haven't done already. There are spots available. GPs in particular are going to have increasing access to Pfizer. So if you haven't already, please talk to your GP around getting a vaccination or book into a state clinic that might be near and convenient for you. So that's probably all from me at the moment, Jess. Thank you.
Thank you very much, Dr. Gale. And I think we have Minister Ward back online.
Thanks, Jesusa. Thank you for having me again. Hi, everyone. Thank you. It's great to be with you again for this important weekly news conference. Can I thank you again for your support and attendance? I also acknowledge the traditional custodians of each of the lands and waters on which we meet and pay my respects to elders past and present. And for me, that's the Gadigal people. And I thank them, and also for multicultural elders and their leadership at this time. Today, I just wanted to speak about support in particular, and ensuring that the right support is getting to those who need it most at the moment in this difficult time is our top priority, and is my top priority in my role as your Multiculturalism Minister in the New South Wales Government. The best way for me to be able to do that is to talk to those of you who know their communities better than anyone. I just want to say that it was amazing that we had at the latest Multicultural Community Forum 270 people, and that was a fantastic turnout, and thank you to everybody, because it's really important that we hear from you. We did have a very fruitful discussion where I was able to answer questions about our roadmap to freedom for the fully vaccinated, double dosed, along with questions about that vaccination rollout and our financial supports and mental health supports. And crucially, importantly, to hear back from the community with that feedback about the government's response to the COVID outbreak. Last week, I also held a forum with Afghan Australian leaders to show my support and provide an update on measures to help the community at this difficult time. It's really important that the Afghan community in New South Wales knows that the New South Wales Government stands in solidarity with them during this incredibly traumatic time, and that we are advocating on behalf of that community. New South Wales has always had a very big heart when it comes to helping those fleeing war and persecution, and we welcome those who come here from Afghanistan with open arms. We will look after them, and I just wanted to make that commitment. In terms of financial support in COVID, yesterday the New South Wales Government announced an additional $287.5 million in COVID-19 financial support, specific support in response to this pandemic. That money will help workers and vulnerable communities in metropolitan, regional and rural New South Wales. And we will see that additional funding in COVID-19 emergency hardship payments, in test and isolate support payments, so you can stay home while you have to isolate and await those results, and community empowerment grants, which have been expanded across all of New South Wales. Grants for culturally and linguistically diverse groups have also been expanded. We heard that more was needed, and we absolutely have responded, and thank you for your feedback in that regard. We want to ensure that we're connecting multicultural communities with those essential services throughout the pandemic, and that money is in addition to our existing commitment of $7.7 billion in COVID support measures. So we really are going all out to make sure that that is getting to every corner of our community, because we know it's just absolutely critical that we support our multicultural organisations. They are best placed to know their communities, to connect migrant communities with those vital health services, to ensure that our vaccination rates keep climbing, that they get tested, and that they really are supported during this time, because that is such an important part of our state's recovery. Every week I talk about the importance of getting vaccinated and how it is our pathway to freedom, but only for those who have had those both doses, the double dose. And it is just amazing to see our vaccination rates continue to rise. It's been fantastic. As Dr. Gale said, we reached 80% of first doses today, which is fantastic. So that has allowed us to lift those curfews in the 12 LGAs of concern. It was really welcome news that having reached that milestone, we were able to respond, and 80% have had that first dose. So now we have a date to look forward to. Already, we know that groups up to 5 fully vaccinated people can enjoy an outdoor picnic together. They can get together in that group. And the Monday after we reach that all-important 70% double dose vaccination level, that will be a phenomenal date. That'll be our landmark date. It's a date that those who are fully vaccinated will be able to enjoy all those magnificent things like having 5 visitors to your home, taking part in an outdoor gathering of up to 20 people. Remember those? Hospitality venues and retail stores, gyms and indoor recreational facilities can reopen, subject to that 1 person per 4 square metres rule. And fantastically, you'll be able to finally get a haircut. So that is great news for everybody. And of course, swimming pools will be open at that time, and you can travel around regional New South Wales, which is welcome news. And there'll also be other benefits like the opening of stadiums and zoos, again with those spacing restrictions and capped at 5,000 people. Churches and places of worship will open, and they'll also be subject to that 1 person per 4 square metre rule, but there will be sadly no singing just yet. So there is a lot to look forward to. But only for those who've been double vaccinated, they'll have those freedoms. And as the Premier said, no matter where you live, please keep going forward. Don't be left behind. Make sure we're all in this together. Encourage your friends, your family, your community to step up. We are continuing our partnership with the community and with our religious leaders. And as a government, I just want to, on behalf of the government, thank all of you for partnering with us, as well as, of course, our critical multicultural media outlets, all of you who convey the messages every day. And as we navigate our way through this pandemic, you're conveying that vital information. Applications have now opened for eligible organisations to share in $10 million worth of funding to support those vulnerable people and multicultural communities in those 12 LGAs of concern. I specifically took that to the Treasurer and he listened based on your feedback that we needed that specifically. So that is for eligible non-government organisations, those NGOs, who have provided already that proven support, those services that they're already doing. We want to make sure that we can boost and bolster them to do what they're doing. To those people in need in those areas, they've been invited by the Department of Communities and Justice to apply. And that's just one part of my recent $18.8 million record funding package announcement. So we're going through applications for a $3 million slice of that package, which will go out to those grassroots organisations who are helping vulnerable members of our community at this difficult time. I really want to say thank you to them, because that will assist our recent migrants, our young people, our seniors, all those groups that we know need that extra support right now. Soon, I'll be able to share with you the successful applicants for a separate funding program, the $5.5 million package to help temporary visa holders, especially our asylum seekers. So I just want to convey that we are putting the proper support measures in place. It's absolutely critical. We are listening, and thanks to your feedback, we've been able to take that to Treasury and get support where it's needed most, responding to that feedback. So we're acting fast on those things. I think I'll leave my comments there and we'll go to questions. Thank you.
Thank you very much, Minister Ward. We'll go straight to a question from Fred Zhang from Sydney Today, and probably this is for Dr. Gale. Our ICUs are reportedly full, and many patients suffering from other illnesses are forced to change their surgery schedule. How would the government solve this situation?
Oh, thanks, Jess. Look, the most important message for everybody in the community is that if you need urgent care, you will get it from the New South Wales health system. And I'd encourage anyone who's at home and not feeling well, whether that's because they have COVID or have symptoms of COVID or are suffering from any other condition, that if you're worried, you call 000, call for an ambulance if you think you might be having a medical emergency, and our hospital system can and will take care of you, including in ICU, if that's what you or anyone in your family needs. Clearly at this time, our health services are very busy. There are a lot of patients with COVID admitted to our hospitals. Our community health teams, in addition to everything they would normally do to care for the health of people in our community, they're also caring for many thousands of people with COVID-19 at home. So yes, the health system is busy. Yes, we are stretched. But if you need urgent care, including ICU care, the system is there to take care of you. And we have some of the best trained nurses, doctors, allied health staff, and the best equipment here in New South Wales to take care of people who are sick and who need our healthcare.
Thank you so much, Dr. Gale. We'll go to this question from Wei Wang from SBS Language Program of Chinese. Questions from their radio audience are not very clear about the permission for hourly workers under the COVID-19 restrictions in Sydney. So, Minister Ward, I think this is a question for you. Is it allowed to provide my customers with door-to-door nail polish, hairdressing, and eyelash extension services? This is a question from a small business owner. She found her commercial competitors are providing door-to-door services.
Unfortunately not. The answer is no at this point. Under the current health orders, those services are not allowed. We're very clear on that. So those people should not be providing that service, and I'm sorry that's the case at the moment. However, we know on the Monday after New South Wales reaches 70% double dose vaccination, personal services such as hairdressers and nail salons can open with one person per 4 square metres, capped at 5 clients per premises. They will only be accessible to those people who have been fully vaccinated. Thank you.
Thank you, Minister Ward. And another question from Wei, from a single mom. Can I hire a babysitter to look after my child for several hours when I have an emergency or get vaccinated? I think we'll pass it on. Dr. Gale.
Thanks very much, Jess. Clearly in the public health orders, our general advice is that people should not be visiting your household unless for very essential reasons, including to provide a caring function. And clearly in a situation for a single mother with a young child who might need to leave home for reasons of vaccination or for emergency care, then clearly that would be a particular circumstances, and there are provisions for caring reasons or in compassionate circumstances for that to occur, because we do understand that people have very practical issues and practical concerns, and that the stay-at-home orders can be challenging, and so there are exceptions. So if that is the circumstance in the case of emergency, that somebody does need to come to the household to provide assistance, that's okay.
Thank you, Dr. Gale. Minister Ward, a question here by Violi Calvert from Radio Tagumpay, from Filipino Radio. What process or system is put in place to allow the vaccinated people to go to restaurants, cafes, etc., and unvaccinated not allowed in? Vaccinated if people feel it's unfair that they have done the right thing, but could be treated the same as the people who are unvaccinated.
Thank you, Viola. It's a really good question. The government's made it very clear that our roadmap to freedom is only for those who are fully vaccinated. So that means people who have had both doses. And we know that on the Monday after we reach that 70% double dose vaccination, hospitality venues like restaurants and cafes will be able to open up. But of course, they will still need to abide by the 1 per square metre rule inside, and outside 1 person per 2 square metres. So we know that retail stores can reopen under the 1 person per 4 square metres rule, but unvaccinated people will continue to only be able to access critical retail. We are working on a system where you can scan your QR code, and that shows, as we're all used to doing now, you scan your code, and at the same time as you check in, it will show your vaccination status, and that will allow you to enter the premises. We're trying to make that as seamless and quick and efficient as possible, and Minister Dominello is working really hard on that. Thank you.
Thank you, Minister Ward. Another question from Fred Zhang from Sydney Today. Sydney is not opening up yet, but many people are already lifting their own restrictions. We have seen photos of Bondi Beach full of people gathering, many even not wearing face masks, and police barely interfere with them. What is your comments, and shouldn't the government enforce rules until we formally open up? I'll pass this on to Minister Ward.
Yeah, thank you very much. Yeah, look, we know that the orders are in place. The virus doesn't see postcode, it doesn't see ethnicity, it just sees opportunity. And so for that reason, we have ensured that the health restrictions are in place, and we've worked very hard to listen to that feedback from different areas. And that's why I've held so many of these forums, to ensure that we are hearing from everybody because it's really, something that we need to keep in place. I said in an earlier forum today, and apologies for those that were in that one already, but I feel like we're running a marathon. And we're almost there. I can see the finish line, but we're really tired. I get that. But we've done the hard yards. We've done most of it. And we need to just stick to these health rules to get us to that final finishing line. And we now know what that finishing line is and what it looks like. And so we have worked really hard with all of our law enforcement, with all of our LGAs, with our councils, to make sure that we're listening to that feedback and make sure that everybody understands the reason why these things are in place. And I know that in every area there have been police presence to ensure that we're keeping people safe and they're abiding by those health orders.
Thank you, Minister Ward. A question from Pawan is often asked, and perhaps Dr. Gale can help. 5 seems to be a strategic number, but a limiting number. Why 5? Normally people will know other couples, so why not having a set of number of or picnics or people at home, as even numbers are 2 or 4 or 6? 5 is rather an odd number. This is from Pawan. Dr. Gale.
Okay, look, thank you, Jess. Look, I understand that question of exactly where to draw the line is a challenging one, but the reality is we've got to draw it somewhere, and we recognise it's not a perfect science, and families will be of different sizes, people's social networks will be of different sizes, so there isn't a great answer other than that we have to choose what we think is a reasonable number, noting that people are going to have different circumstances, different social connections, different size houses, all kinds of different permutations in our diverse community. And so we have to draw a line somewhere, and that's a decision that's been made.
Thank you, Dr. Gale. Another question from Pawan Lutra from Indian Link. Question is for Minister Ward. Minister, great news today. Congratulations on the vaccination rates are so high and the curfews are getting lifted. There are also discussions on international travel starting soon, and I understand there will be travel bubbles formed with certain countries. That is wonderful, but we need some help from you as a multicultural minister. A number of multicultural communities come from countries which are not expected to be part of these travel bubbles. We need help in lobbying for the federal government to allow double vaccination in eligible people from those non-bubble countries. Please note these can be parents, many of us are here, have been people who have been double vaccinated. Can we look for your support in raising this with your counterparts in the federal government?
Thank you, Pawan, and all the great team at Indian Link. They're doing amazing work, and thank you for your videos, which are fantastic, and all that you're doing and everyone in the community. Look, it is a priority to try and work. I will always be your advocate, and I'll always work as hard as I can for our multicultural communities to make sure they're top of mind when these decisions are made, and the particular nuances of different communities and culturally appropriate considerations are taken into account. It is a high priority for the government to try and have arrangements in place so that travel can be reinstated in a safe way, and that families can be reunited for exactly those reasons. I'm not a health advisor, but I understand they are working really hard on it behind the scenes, and the health advisors are the best that we can find, and so we're basing that on their advice, and there will be more to say on that, but I absolutely want that to work. And I want to find a way forward where we can get families back together. So please know that's an absolute commitment for me. I will be speaking with federal counterparts, and I will make sure those nuances are taken into account. Thanks, Pawan.
Thank you, Minister Ward. And thank you again for everyone who's asking the questions and the multicultural media who are online today. Pauline has a question. Can you tell us more about the vaccine passport, and how valuable is this, Dr. Gale, for people to have the vaccine passport?
Yeah, thanks, Jess. Look, as we go forward, as we know, even in the roadmap, that a lot of the freedoms and a lot of how we deal with COVID in the longer term is going to depend on vaccination status. And so having the easy ability to be able to show vaccination status is important. And essentially that's what a vaccine passport is there for. And we're all learning as we go. This is a new situation for all of us together in society, as it is for us in health, as it is, I'm sure, for government as well, about how to navigate these issues. And so what we know as well is that while we have a roadmap carved out when we reach 70% double dose, that it is going to be a longer journey with COVID and learning to live with COVID. And while we have this immediate push to increase our vaccination rates, in reality, COVID is going to be a disease that stays with us, and vaccination, like we talk about flu jabs and like we talk about jabs for other things, is going to be something that's part of our society going forward. And the role that vaccine passports or being able to show evidence of vaccination plays into the future is something that we're still working through and that we're going to have to evolve, including for us in health, just as it's going to be for the community. But the principle of being able to access information that can readily show somebody's vaccination status is going to be a really important part of how we deal with COVID in a measured way in the months and the years to come.
Thank you, Dr. Gale. Minister Ward, would you like to add to that?
Thank you, Jess. You're a mind reader. I was just thinking I'd like to say something, so thank you for that. That's terrific. You're very intuitive. I just wanted to add that it really is something that is very important, and we are working really hard with our federal counterparts to make sure that that's something that we get right. And I've never dealt with a pandemic before. As Dr. Gale says, we're all learning as we go, but there's great motivation for us all to get these things in place. But can I say that I think importantly, it's not, so I'm not an expert in this area, I'm not a health person, but I know that in some countries you have to verify that you've had yellow fever vaccinations. And Dr. Gale probably knows more about that than I, but there's some vaccinations that you do have to prove to go into certain countries, or you're strongly advised to get. So things like that I think we are working on, and we want to get that balance right and make sure that we are able to implement those in a way that is optimal for everybody and gets us travelling but does so safely. So yeah, thank you.
Thank you, Minister Ward. Dr. Gale, I have this question about people now, parents now are booking for their kids who are 12 years old. What is your message for that, and how can they go about it?
Yeah, thanks very much, Jess. So clearly now that vaccination has been opened up down to children 12 and above, that's really positive, and I think is going to be really important for us as a community to make sure that we achieve that greater vaccination coverage as a population. And we know that's going to be really important, particularly in managing and reducing the risk of ongoing transmission of Delta in the future. So to really increase and push our vaccination rates up as high as we possibly can as a community, and being able to vaccinate children, at the moment it's sort of children over 12, is going to be a really important part of increasing our overall vaccination coverage as a community. And it's also really important to protect our young people. We know that in the vast majority of children, COVID is a mild disease. However, it's not nothing either. And we want our young people to be well and healthy. And so we're really pleased to be able to offer vaccination for this younger age group. And it's also really important as a tool to enable that children can go back to face-to-face learning wherever possible. And the greater the vaccination rates in that, younger children, is going to just help us get back to really high quality face-to-face education again, in the way that I know that children are keen to see, that parents are keen to see, that our teachers are keen to see, and that we as a society recognise as being really important for the well-being of children.
Thank you so much, Dr. Gale. And that's about it for our time today. And I know the minister is also very busy, and Dr. Gale has some meetings coming up. But thank you again for joining us. Minister Ward, would you like to have your final words?
I just want to say thank you, everybody, and apologies for the technical issues. We all seem to be having them, but I really very much appreciate, again, your important attendance today, and thank you for all the work that you're doing. We have reached an amazing milestone, so we've seen the benefits that brings, and I just want to thank you all for all your terrific work in getting us there. We're not far away. Thanks, Jess.
Thanks, Minister. Dr. Gale?
Oh, thanks, Jess. Look, just a big thank you to everybody. We know these last months have been extremely tough for people, but I think as we can see now with the high vaccination rates, with some promising signs in LGAs and communities that we were really worried about, that we are starting to see a bit of light at the end of the tunnel, and it shows that our collective efforts are working, that all the measures that have been put in place together are working, and I just want to thank everybody for continuing to stay the course. You know, we've got a journey yet to go, but we're on a good path. So thank you very much, everybody.
Thank you, Dr. Gale. Thank you, Minister Ward. And thank you to everyone who's joined us today here in the Multicultural Media Online Forum. And there are some questions that we weren't able to answer, but we'll try to answer them next time. And if you need the recording, please go online, Multicultural Health Communication Service website. And thank you so much. Please encourage everyone in your families and communities to get vaccinated. Stay safe.